So again, like I was saying, you want to think about, is it early in the process or later in that disease process? Is it before surgery? Because we do know we do certain things before surgery that we not necessarily would do after surgery. So break down that question, that scenario, break it down. Look at those keywords: early, late, during, after. And then formulate, if you can, formulate in your head or try to pick out what you think the answer should be before you even look at your answer choices. And therefore, you have went through your foundational knowledge, your understanding of the disease process, the concept that is being talked about in the question, and you put together all the information that you know before you actually look at the answer choices. Therefore, you don't get mixed up or confused when you look at the answer choices. You want to read all answer choices. If part of the answer choice is correct and one part is not, more than likely that is not the correct answer. So the answer choice has to be correct all the way through the answer choice. And in all else fails, they say use process of elimination, make an educated guess. So again, these key terms, look for those. If an answer choice or even the question says all or never, those are key terms. Sometimes all will automatically eliminate an answer choice because some things are never all and some things are never or only. So again, look at the answer choices. Look for these key terms: always, all, never, only, every, and forever. So a question could be talking about a concept, but then when the specific question that you need to answer could be talking about the opposite of what the scenario is talking about. For example, high blood pressure versus low blood pressure. So just keep in mind of those things. Again, it just comes down to breaking down that question in that scenario and seeing what you need to answer. And then you want to prioritize by using Maslow's hierarchy of needs. That will help you select the best answer choice. We know always airway. Remember, always airway. Airway, breathing, and circulation. So, of course, watch your time during the test. You don't want to run out of time. So make sure you're watching your time. Um, be well prepared for the exam. Make sure you go over all the key concepts, the topics. Just make sure that you're taking time each day as the exam approaches. Do not wait until the last minute to review your information and try to cram. You will need to take time each day, a few minutes here and there to review the content. You do want to eat properly before the test and focus on success. You have got this. Okay, so now let's go ahead and move on to looking at some of our concepts. I'm going to share my screen again with you. Okay, so we're just going to go over some key terms and concepts just to bring all that to your remembrance. Okay. Beneficence requires that the nurse do good, the most good possible within the circumstances. You want to ensure adequate pain control. An example is ensuring that adequate pain control. This is an example of beneficence. All choices for a patient are made with the intent to do good. And you may have some outcomes that are not, people might not like, but in the instance, given the circumstances, you did good, the most good possible. When we talk about distributive justice, it concerns the socially just allocation of resources. Advocate, an example of that would be advocating for insurance coverage of hospice services. That would be an example of distributive justice. So that is where we're allocating, making sure that the resources are distributed accordingly. Now, when we talk about non-malfeasance, first, do no harm whenever possible. An example of that would be avoiding intramuscular injections. Okay, autonomy is our ability to make decisions and have a say in the direction of our lives. So we want to respect the client autonomy. So if they say that they want treatment stopped, we want to respect that. No matter how you feel about them stopping the treatment, we want to respect their own ability to make those decisions. So when we're talking or providing care for someone that is hearing impaired, you want to make sure they can see you when they're speaking. You want to make sure that there's adequate lighting. You want to stand in front of the client. And you want to just enunciate clearly. You don't want to exaggerate any lip movements or anything like that. Speak in a normal tone. If the client is profoundly impaired and uses signing, a sign language interpreter, they usually are available. If the client cannot understand by reading lips, you can try using gestures or writing notes. But you want to make sure that you're standing in front of them, that there's adequate lighting, and that you enunciate or speak clearly in a normal tone. Therapeutic communication techniques uses restatement and repeats the main thought that the client expressed. It's not changing up what you said, you're just restating. This assures that the client, the nurse is listening and attempting to validate what the client is saying. And that helps you establish that rapport. And then it helps them to, once they feel comfortable, they'll give you more information, the information that you're needing to do a good assessment so that you can provide those interventions for them. And if you're just trying to gather more information so that you can give that information to the healthcare provider, by restating and repeating the main thought of what they express will allow them to be more compliant with answering your questions. And if you're trying to do a procedure, they'll be more compliant in letting you do that procedure. Because again, this therapeutic communication, it focuses on the patient. The goal is to promote a greater understanding of the patient's needs. You're trying to gain a better understanding of the way they're feeling. A stroke is a medical emergency. Symptoms of a stroke include trouble walking, speaking, and understanding. There even might be paralysis or numbness on that face, the jaw, the arm, or leg. In early treatment, they want to try to administer medication. They call them clap busters, and that minimizes the brain damage. And then other treatment just focuses on limiting complications and preventing additional strokes. So aphasic is difficulty expressing or understanding language. You want to face the client when talking to them. You want to establish and maintain appropriate eye contact. You want to speak slowly and distinctly. You don't want to exaggerate what you're saying. You can use gestures and body language if needed. Give the client directions that are clear, short, and simple. If there's a need to repeat something, the nurse should use the same words a second time. Don't try to change up what you're saying, and because that might confuse them, because they might think you're saying something else or something different. So if there's a need to repeat something, the nurse should use the same words a second time. Okay, so remember, discharge planning begins at the time of admission. Remember, if the person's coming to an urgent care center, they're coming to the hospital, they're not coming there to stay. So when they're being admitted, you're looking ahead in order to meet that client's needs when they're ready to go home. If home be a long-term care facility, one of the nursing homes, or if they're going home and they're needing assistance, you would need to set up that home health care. But discharge begins at the time of admission, because remember, they're not coming there to stay. They're just coming there to get that acute condition stable or as back to their norm as possible. So then you want that person to be able to go home, wherever that is, whether that's back to the home itself or the long-term care facility. They do have like these step-down units or these assisted living facilities, wherever it is. But you want to go ahead and start thinking that through. Even if your plans may change, but still you want to start thinking, do they need an oxygen concentrator? Are they going to need someone to come in and to put a ramp in? Start thinking about all those things when that person is admitted. Okay, so when we're talking about learner-related barriers, you want to determine the ability to read and comprehend written instruction. So that's what we're talking about. So learner-related barriers are talking about determining the ability to read and comprehend what is written. So a response like, just tell me what I need to know. I don't like to read. That would be a defense, because that person might more than likely has a learner-related barrier. So you want to allow the patient to read, allow the patient to restate, do a teach back, and allow the patient to ask questions. Okay, so we do know that the occupational nurse, they work in the settings where people work at. They conduct assessments of the workplace itself. They do direct observations. And this right here allows that nurse to see if the different things and programs and interventions that she's putting into place, the education she's providing, if it actually is working. For another one, if they're actually are doing it. And so, for example, if the nurse keeps getting all of these certain types of injuries and they place this education program in place, the nurse needs to go out and assess and see what is actually happening. Do his or her educational program need to be changed, revised, or does it actually need to be implemented? are the people actually doing it? So for that occupational nurse to go out and look at the workplace, that gives them more information about what's really taking place. So we know the American Nurses Association standards of care. They are general, they're not specific. But we do know that the other healthcare facilities, they set their guidelines and their policies and procedures, the things that they do inside their facility. They're all based on the standards of care that are provided by the American Nurses Association standards of care. We know that these standards are general. And so, for example, if a long-term care facility, the services that they would provide would be different than in a hospital setting. Not all the way different, but somewhat different. So these guidelines, they are general, so they allow the different entities or places, long-term care versus acute care, to be able to set their standards and guidelines in inside of their facilities that will be similar, but they're not so specific that the people can't adapt to the different environments. Okay, cultural competence requires an individualized approach for each client because everyone is unique. We have to gather data on their beliefs and expectations. We do not need to treat every client with the same, nor do we want to treat them the way we would like to be treated. We have to respect differences in culture. We have to first recognize what are our own beliefs, and so that we can move forward and provide care for someone else. So we know that with the electronic cigarettes or the e-cigs or the vaping, the solution that is being used for those, that stuff is poison. So if a child comes in contact with that, either that device or the oil itself, because remember the device actually has the oil in it, or the oil itself and is absorbed, that child could possibly be poisoned. So, but then we do know if the child is around the vapor, then that is harmful as well. But initially, if that child comes in contact and that oil is absorbed through the skin, that child could potentially be poisoned because of it. So when we talk about blood alcohol concentration, it is determined by the concentration of the alcohol in the drink, like how much alcohol is really in that drink. The rate of the drinking, like how fast is that person drinking? Is it just a drink today and maybe another one next month, or are they drinking every 30 minutes or every hour? And then the rate of absorption. So if that person is consuming alcohol and they're eating, the rate that that alcohol is being absorbed by the body is different if someone does not have food on board. And we have to also consider that person's weight, their sex, and then the rate of metabolism. Those are all things that should be considered. Okay, I'm getting ready to share and go over some more concepts with you. So remember, for community, you are taking the concepts from Mid-Surg, PEDS, all these different places, and the patient is in the community. So it doesn't change, but you just have to think about where they're at home. They're in their home-like environment. So, but still taking consideration if the person or the patient in the scenario is a child or an adult. Okay, and let's share the screen again, going over some more important concepts. Okay, so we do know that, we do have to consider bioterrorism, chemical warfare. And so sarin is a nerve agent and it's toxic. It's odorless and tasteless. So if someone suspects that sarin is being used or someone has been exposed to it, then we can almost definitely know that respiratory distress is a symptom that they are going to experience, and more than likely death will occur pretty quickly. So for toxic spills, we do know that everything is considered contaminated. Their clothes, even if they wear contact lenses, and everything should be removed and discarded. You want to protect yourself when you are actually touching and trying to dispose of the clothing or the contact lenses. Clothes should be placed in a plastic bag. In the contact lens should be removed and discarded. You might want to use those tongs to prevent touching, and for sure, just make sure you don't come in contact. You know, we have a habit of just touching things and letting things lay up against us. So make sure that those things are not coming in contact with you. So when doing a disaster or when you're having to give instructions during the impact stage, you want to give firm directions. Is they're needed. You want to get people to safety, but you want to give them the information they need in order to keep them safe and the people that they're taking care of safe. So you don't want to talk loud. You do not want to give a bunch of instructions. You do not want to just single-handed correct the situation. For an example, you want to firmly instruct other staff. Hey, you all, I need you all to start moving the people in the wheelchairs from this place, from zone A to zone C. You know, place the Jerry chairs in zone B. So you want to give firm instructions and give them instructions what to do, where to go. You don't want to shout. You want to remain calm. So we're comparing the lesions of chickenpox compared to smallpox. Smallpox lesions can be found on the palms of the hands and the soles of the feet. Well, typically chickenpox are found everywhere. Those lesions, they appear on the chest, the back, the face, they just spread over the entire body. But for the most part, smallpox are found on the palms of the hands and the soles of the feet. So safe drinking water. We do know sometimes in disasters, we have these tornadoes and our water supply is limited, but we need safe drinking water. What can we do? In the event that they can boil, because sometimes people have the electricity might be on or they might have gas in the event that the electricity is off, they can boil the water. You can use 1 part bleach to 6, is it 1 to 10 or 1 to 16? But they can treat the water with household bleach. I'm not sure about the amount of water versus the bleach, but you can use that bleach to help that drinking water be safe. Also, you can remove the water that's inside of the water heaters, because remember that water's already been in that water heater, just waiting on you to turn those faucets on in the home. So that water is rendered safe for drinking. So when you are delegating tasks to unlicensed personnel, remember at the end of the day, at the beginning of the day and at the end, that you are ultimately responsible for the outcome, that even though you delegated, so you are still responsible. So you still want to oversee, ensure that they complete the task as you have assigned. You also want to make sure that the person is willing to take responsibility for the task assigned. You will not assign them a person that is deemed unstable. You want to give them specific instructions about what is to be done step by step. And you want to review for understanding. You might want them to recall or recite what you asked them to do. So we do know that we do have type 2 diabetes. That's a big concept in our readings. So long-term consequences of poor glycemic control, meaning those glucoses, those finger sticks are not under control. It could lead to recurrent infections, delayed wound healing, and it can lead to PVD, peripheral vascular disease, which is a slow and progressive circulation disorder. With PVD, there's a narrowing of the blood vessels. So DKA, or diabetic ketoacidosis, is a serious complication of diabetes that can be life-threatening. So we want to look at the early symptoms. Remember, we talked about those key words. in phrases when we're talking, when we're trying to answer a question, if they're asking you, the question is specifically talking about early versus late. Remember, you need to answer accordingly. So some early symptoms of ketoacidosis are polyuria, that's constant urinating, fatigue, anorexia, abdominal pain, and they will have that fruity smell on the breath. And then the later symptoms include sunken eyes as a result of excessive dehydration. So diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. So those classic symptoms that people will see before they really know that they have diabetes, those classic symptoms are the 3 Ps: constantly urinating, constantly drinking, and they're just hungry, appetite out of nowhere. Like, what is going on? I'm drinking, using the restroom, and I'm just drinking all of this water. And so those are the 3 Ps. Those are the common symptoms of diabetes. So we need to prioritize some changes to help manage a person that has diabetes. So they might want to do weight reduction. So that would include maybe changing up some things that they're eating and also increase that physical activity. Those things can restore those blood glucose levels back to normal. They want to inspect their feet daily, do those annual eye exams to detect whether or not there's some diabetic retinopathy that's going on. So if the glucose is not under control, it can start to affect those blood vessels in the eye. So they will need to keep their annual eye exams. So we know we're drawing up insulin. We want to draw clear before cloudy. Insulin helps blood sugars enter the body cells so they can be used for energy. Even on 6 days, the patient with diabetes, they need to take their regular insulin, but they also need to know that they need to check their blood sugar more frequently. Complications of diabetes. This is when the diabetes is poorly controlled. There may be decreased wound healing. All skin should be inspected. If there's an alteration in the skin, the nurse should first cover it with a clear occlusive dressing to protect the area from scratching or infection. Then, of course, you want to document it. You want to notify the healthcare provider, and you want to look at their nutritional intake, because we do know that nutrition is supposed to help with wound healing. So another important concept is high blood pressure or hypertension. High blood pressure, also called hypertension. Your blood pressure changes throughout the day based on your activities. So over time, if that blood pressure is left untreated, it can cause health conditions such as heart disease, congestive heart failure, kidney failure, and stroke. So the person should get those numbers under control, whether it's through diet and exercise. They might have to end up on a medication, an antihypertensive. But over time, if that blood pressure is not brought under control, it could lead to heart disease, congestive heart failure, kidney disease, and stroke. So tests that can determine changes in the kidneys, because we do know that uncontrolled blood pressure, it does affect those kidneys. So some different tests that can be ordered for a person to determine if there are changes in the kidneys or renal function studies, that BUN and that creatinine, the chest x-ray, a urinalysis, a EKG, or either electrocardiogram. So loop diuretics is a type of medication that is used to help keep blood pressure under control. Loop diuretics are potent. They are potassium wasting diuretics. And so what that means is if a person has to take a loop diuretic, they're going to lose an important element called potassium. So it is recommended that that patient start eating some foods that are high in potassium, or they might have to even take a potassium supplement, because we do know that there are all different types of high blood pressure medicines out there, but the right medication for your patient might be a loop diuretic. And unfortunately, it does waste potassium. But in order to offset that potassium being waste, the person just needs to consume their or increase their potassium intake. For example, they need to eat more bananas and potatoes. They want to avoid foods that are sodium rich, like canned foods, processed foods, hot dogs, and things like that. Okay. We have reviewed some important concepts. I encourage you to, again, read through each question, understand what the concept is, and the question actually wants you to answer. Feel free to reach out. Happy learning.